My name is David Brackett. I'm 42 years old. Going all the way back to my early 20s, there was an encounter with the woman that I was dating at the time. We were having sex, and she was on top, and however she landed, I heard and felt a pop. Loud and significant enough and just abnormal enough for me to kind of stop what I was doing, kind of push her back. Nothing happened after that. That was, I went on my merry way and life continued on. Fast forward to my later 20s, that's when I first started to have symptoms of ED, and which I later found out was Peyronie's. When I had the ED symptoms, I went in to see the doctor, and that's what they diagnosed me with, where I was having pretty significant curvature, not enough to where it was impacting intercourse or anything like that, but it was bothersome to me. I wasn't able to get as firm of an erection, and it was uncomfortable and just obviously embarrassing. There was surgery options available. They could prescribe medication like Cialis or Viagra. I definitely didn't want to go through surgery, and so I just kind of continued to research and look into other options. I got back on Google and I was like, let me see what other technology is out there. I know new technology is always coming out. And that's when I Googled and found Dr. Vigor. What made me pick Dr. Vigor was the reviews. I really liked the look and feel of the brand. Was just easy to kind of understand, and what was being offered. It just spoke to me differently, quite frankly. When I first came into Dr. Vigor, I was greeted right away and just really felt taken care of. I felt that the individual I was working with explained to me how things work. They laid out what the options were and the potential benefits of those options. I really felt that I was in the driver's seat, and I could ask the questions really openly and get clear responses so that I could make the best educated decision. What I was interested in most was being able to break down that scar tissue, and that's really what the FirmWave does best. My experience with the FirmWave was really, really good. After each session that I completed, I started to see improvement gradually. On a scale from 1 to 10, 1 being no curvature at all, and then 10 being complete curvature, I was at about a 4 range there, and I just gradually saw improvement after each session and continue to see that. So today it's probably at like a 1. That's a huge improvement for me. I didn't really experience pain. It was really more discomfort, where it's just uncomfortable. But again, it's a short period of time. It goes by really quickly. The Vigor shot is a procedure where you come in, your blood is drawn, they spin that at a very fast rate, and they're able to extract your hyper-PRP, which contains growth factors, and inject that back into your penis. And what that does is that also increases the sensitivity in your penis and allows for firmer erections.
We've started. That was the first shot right there.
Mm-hmm. Yeah, just barely feel the prick. I mean, it's like a 1 out of 10.
The Vigor shot was something that was easy to do, painless, no discomfort at all, and helped create more girth and heightened sensitivity. The FirmWave and Vigor shot is the full package of being able to improve the blood flow, the firmness of the erection, the sensitivity, and just overall confidence. I saw the improvement with being able to get more frequent erections, waking up with morning wood more consistently, and being able to have more desire, quite frankly, to be able to have intercourse. Over the last few years, I started to notice low T symptoms, which I now recognize as low T. At that time, I didn't know what it was. 3 key symptoms for me was extreme fatigue, brain fog, and just overall lack of energy. And I would add a 4th would be just feeling a little bit off and not feeling like I was myself. The Dr. Vigor team laid out all the different options for me, from the calibrated TRT pellets to the shots. And for me, what made the most sense was the pellets. What I liked about that is that you only had to get the pellets once every 3 months or so, whereas the shots would need to be more continuous. The actual procedure itself of getting the pellets inserted, they first put a local anesthetic in that particular area. So I didn't feel anything when they actually did the procedure. After that, you're bandaged up, and you have to keep that bandage on for several days. After getting the pellets and doing my blood work, I was in the 900s. So a huge jump from 300s to 900, and the brain fog, the fatigue, it was just gone, just completely gone. Zero brain fog. That fatigue that I was feeling was gone. I encourage anyone who's sitting there feeling like I'm on the sidelines and I don't know what steps to do, take those necessary steps, because it can take your confidence level, your sex drive, and your ability to perform to the next level in a very short period of time.